The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hi folks, I'm Dr. Fazil. You are watching November 2024 edition of Dr. Fazil TV show. Folks, the topic of the discussion today is prostate disorder. So as you know, all my shows and most of my shows I use holograms. So the hologram and the use of the slideshows help to explain my points better. So I will use them as we go through this discussion or about this topic of enlarged prostate. So the topic of discussion is enlarged prostate. So remember folks, prostate is a gland which is part of the urogenital system in men. It's not part of the female anatomy. So before we go further down, well, let's talk about the prostate problems. So when the prostate become enlarged, which is a physiological process with time, as men get older, the prostate get bigger in size, and it can cause pinching of the urethra, which is the outflow tract of the urinary system from urinary bladder to the outside world, and it can cause poor urinary stream, difficulty pass urine, and that's just the beginning of the tip of the iceberg. So as I said, before we go further, let's do some discussion through holograms. So I'm going to bring one hologram right here, so you can see this is the hologram, and yeah, well, let's twist it a little bit. Okay, let's freeze it right here. So now you can see these are two kidneys, and these are the ureters. We call them ureters, and they drain into urinary bladder. And as you know, the kidneys they clean the blood. I mean, they have multiple functions, but for this discussion, they filter the blood, make urine, all the dirty chemicals. They come into the urinary bladder and they get stored. And when it gets full, it passes through this urethra and it goes outside, right? So the difference between men and female anatomy is that here you see the urinary bladder. Let's bring it up a little bit. Right underneath that, there's a little gland. That gland is prostate gland. And as I said, female don't have it, men have it. So, so now you know, right? So let's have this hologram go back right into the floor. Let's talk about the issues. So as I said, there are a few issues with the prostate. Number one is enlarged prostate. We call BPH, or benign prostate hypertrophy. That's common terminology which we use in the medical profession, right? So let's bring another hologram. You can see this is a normal size prostate. That's enlarged. That's more enlarged, and you can see as it's getting enlarged, it's pinching the urethra, which is going through the prostate, right? Obviously, that will cause obstruction for the urine to flow, and it will cause back pressure and symptoms. There are medication to fix it, by the way, or surgical procedures. So we'll talk about that toward the end of the discussion. Let's have this hologram go away. Now, folks, there are other disorders of prostate as well. Prostate cancer is a pretty common problem. One of the most common cancer among men is the prostate cancer. So that need to be screened through a blood test known as PSA, prostate specific antigen, or manual exam yearly is also could indicate if there is a change in the, and you can see on the slideshow in the back, the prostate cancer on the examination, we call it digital rectal exam. It become more hardened or irregular surface as compared to smooth and soft surface. So as your part of the physical exam, we do that to screen for early detection of prostate cancer. The other thing is, infection of the prostate. We call it prostatitis. Prostatitis. Itis, anytime we put itis, that means inflammation or infection, right? So that can also cause pain and difficulty in passing urine, sometimes blood in the urine. That infection is quite a bit of difficult to treat. Men do not get a urinary tract infection that much, but if they do get it, and if it gets complicated, it can reside inside the prostate as well. And then the way the anatomy of the prostate is, it does not have a very good blood supply. So the most antibiotics which we take to take care of the infection, they have to go through the bloodstream. And if the blood is not there, antibiotic is not there, right? So that makes it difficult to treat infection. And if you don't treat it in a timely fashion, it can cause chronic fibrotic changes and strictures and pelvic pain, chronic pelvic pain. So if you think you might be having prostate infection, do contact your providers and get it taken care of. The treatment is available, but it's prolonged. 4 weeks to 6 weeks of antibiotics will do it, right? So that's one of the issue about prostate infection. And obviously that can spread from prostate to the bloodstream and cause sepsis. Sepsis is a very lethal condition. It can kill a person, right? So be aware of that. Also, it's not just the symptoms or inconvenience. Enlarged prostate, either it is benign or due to cancer. Both can cause the same early symptoms like difficulty in passing urine. So don't always assume it is just a benign or innocent enlargement of prostate. It can also cause, like prostate cancer can also present with that symptoms. Obviously, with different kind of, when you do a prostate exam, it can present with different kind of feeling. The prostate surface would be more nodular, irregular, hard. So folks, those are the few symptoms and signs of prostate enlargement or prostate cancer and infection. What are the, besides, difficulty in passing urine, what are the downstream side effects? Downstream side effects, let's bring another hologram right here. And you can see this is the bladder and the prostate is right here. As you can see, initially, when the prostate is getting enlarged, the urinary bladder has muscle inside. It has to push harder and harder to pass the urine through this pressure point. And the bladder starts to become more thick. The muscle started more thick. Eventually you can see, let's have this hologram go away and bring another hologram right here. And you can see it has little pouches now on the side. We call it diverticula, right? So now it started to develop outpouching and diverticulas, and it's a sign of impending urinary bladder failure, right? And let's have this hologram go back again there, and let's see a slide show in the back. You can see now the urinary bladder is so distended that it wouldn't be able to pass the urine through the prostate, even though it has become hypertrophic. And in the later stages, let's see another slideshow in the back, the bladder have failed. I mean, urinary bladder, even though if we fix the prostate now, the bladder muscle is gone, right? So now it's a patulous bladder system, and that's where we don't want to get there. So if you do have symptoms of prostate enlargement, as I said, there's medications available, medication like Hytrin, which open up the sphincter of the prostate. You can take it once a day at night, along with testosterone blocker, right, like finasteride. It lowers the size of the prostate. Both works together in a different fashion. That's a common medication. And then it can shrink the prostate so the symptoms go away and the bladder keep functioning properly, right? Folks, so obviously prostate cancer is a different story that has to be treated by urologists or oncologists. But do get it treated. I mean, old days, they used to say you ain't gonna die of prostate cancer, even though you got diagnosed with prostate cancer, you're gonna die with something else. But that's not true. Well, the reason is that now people are living longer and longer, so the life expectancy have changed. So if you do get prostate cancer, it'll get you. So don't let it go, and just keep an eye on its situation. Get it done fixed. There's so many treatment options. There's injections, there's radiation, surgeries, and there's a whole plethora of treatment available to treat prostate cancer, especially if you are in early phase. You don't want to wait till it spread. Even if it spreads, still it can be taken care of, but obviously more side effect with medications, which would be required at that time, right?
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So there's a few other things for prostate surgery, enlarged prostate. If your medications are not working, we can use something known as router. I mean, that's a common term, a TURP, we call it TURP, TURP, transurethral resection of prostate. You can see a slideshow in the back. The prostate has been a little bit chipped off from inside. It opened up the prostate and you're able to pass the urine. The new procedure is a urolift now. So you put 2 stitches inside. You can see the slideshow in the back where the urologist, which is the surgeon of the prostate, put stitches inside the urethra, inside the prostate, and open up the pathway. The urine can flow easily, right, folks? So that is medical and surgical treatment of enlarged prostate. And prostate cancer is treated differently. Obviously that's beyond the scope of this discussion today, but the point I'm trying to make is if you do get diagnosed with prostate cancer, don't ask your neighbor how to fix it, ask your provider. Believe me, we'll get the better answer. And as I said, the old story that you would not die of prostate cancer, if you do get prostate cancer, is not true anymore, since people are living longer and longer, so you will have problems if you do get prostate cancer. I mean, prostate cancer could be diagnosed through, obviously family history, your symptoms, examination, or the blood tests like PSA, prostate-specific antigen, but also through biopsies. Prostate biopsies can be done in office. Another thing is MRI of the prostate. MRI of the prostate is a pretty good test to diagnose without doing biopsy if you have prostate cancer, but it will pick it up quite a bit. So through that diagnostic process, once it's diagnosed, then jump right on it and get it fixed. So the last thing is the prostate infection, right? We call it prostatitis. And again, it's a rare infection, but it's not uncommon if it does get. Difficult to diagnose if the history is not very clear, but if there's an infection, a urinary tract infection in men, which is coming over and over for no reason, or it would not get better with a few days of treatment, like 7 days of treatment, then we do have to consider prostate infection in our differential diagnosis. So there's a way to treat it. I mean, there's a way to diagnose it, right? You do a urine sample, check the infection count in the urine, and then you manipulate the prostate, and then you do another count. And if there's a big difference in the before and after a bacterial count in the urine sample, then you know the infection is coming from the prostate. So that's the right way to diagnose it. And then we can see what kind of infection you have, and we can give you the antibiotics. As I said, the treatment is generally 4 to 6 weeks long. But if you do get prostate infection, don't wait too much, because it can cause scar tissue formation, that can cause chronic pelvic pain, discomfort, and there's no treatment for that. And then also it can spread to your bloodstream, other part of the body, and cause more lethal consequences. So if you do get it and there's a diagnosis, do talk to your provider and get it fixed, folks. So on that note, I think, so we talked about those two medications, finasteride, Hytrin, tazocin, tamsulosin. They all fall in the same category. So yeah, there are some medications available. Common problem, enlarged prostate. And don't ignore it, because if you have enlarged prostate and you fail the bladder, even if you get the surgery or start a treatment, it will not get better, because now your urinary bladder has failed. So now even if you get the prostate surgery done, you will have an incontinence, urinary incontinence. So, and that's why sometimes the urologist for chronic enlarged prostate, they will check the bladder functionality before they do surgery, because if they do surgery, now you will have a leaky bladder and that's become a problem. Then you will have to use, in that situation, instead of using medication, just use a catheter, a straight cath. You can see in the slideshow in the back, you put a catheter a few times a day. And obviously, it's, system is available, but it has its side effect, inconvenience, and also risk of infection. Now, folks, if you do have that problem, let's say if your prostate is has caused issues to the bladder, and you got the prostate fixed, and now you have a leaky bladder. There's a new technology now you can see in the back. They put an artificial sphincter inside your scrotal area, which you can pump and unpump when you need to go, and that's pretty modern technology. So basically, when your bladder gets full and you feel like you need to go to the bathroom or restroom to pass the urine, you just go there, unpump the pump, or push the button, and it's under the skin, so it's not going to get infection. Pass the urine, and then you push the button again to close the sphincter again. So that's make your life as close to normal as possible. Other complication of enlarged prostate, which is not treated, besides bladder failure, is the kidney failure. So I have seen patients which have, kidneys have gone dysfunctional, and then you will need to have hemodialysis. Dialysis, either home dialysis or hemodialysis. And that's one of actually the patients which are on dialysis have a good portion of that patient have enlarged prostate, but which was never treated, and it has caused, and it did cause back pressure. Let's bring it up. This is another hologram you can see. So this is enlarged prostate. This is getting bigger. The bladder is getting distended, and now the pressure is transmitting to the kidneys. The kidneys get swollen, right? We call it hydronephrosis. So kidneys get swollen and they don't function. They don't filter, right? So when you do blood tests, you will see a very, very bad blood test, and now you know the kidneys are not functioning. So it's a chain reaction, right? So simple problem can cause you major issues. Because now not only you need to have your prostate fixed, but you need a new kidney as well, or dialysis, to clean up your bloodstream to keep you alive, or a kidney transplant, which is a very, very expensive and lengthy process. And then you need immunosuppression to keep the kidneys working, right? So folks, let's avoid all that problems. Stay on top of that. Listen to your body. If you're having difficulty in passing urine, do get checked up and get it fixed. It's very cheap to get it fixed. Remember, folks, prevention is better than cure. On that note, folks, it was my pleasure to have your time to present my presentation to you for Dr. Fazil Show for November 2024 edition or episode. So I will be back next month with more useful topics for your education and health. Stay safe. Dr. Fazil.